Hi, we have a great founder at ViVE, and please tell us who you are, what you do.
Yeah, thanks for having me. My name is Joshua Liu, one of the founders and the CEO of a company called SeamlessMD. We essentially digitize patient care journeys. So imagine a patient's going through a surgery or a cancer journey. We help health systems deliver automated reminders, education, and symptom monitoring across that journey. And so we help patients stay on track. You have the care team monitor how you're doing, and we help lower length of stay, readmissions, and cost of care.
I know you're Canadian, but most of your clients are US based, right?
It's like half and half.
Okay.
Yeah.
Any interesting insights about selling to Canadian health systems and American ones?
So the unique thing is that the actual healthcare delivery is the same. What changes the business is the actual reimbursement model. So in the US, there's a lot more free market competition. So folks care more about competing on patient experience and consumerism. You have a lot more value-based care incentive models in the US. So CMS readmission penalties, bundled payments. So there's a lot more motivation to solve both patient experience and economic problems. Whereas in Canada, everyone cares about experience and outcomes, but no one's competing with each other. So they're not as motivated to fix some of those problems.
Interesting. But the sales cycle is longer in the US, I assume, or not really?
No, it's kind of similar. The difference is that in Canada, there were moments in the recent years where, especially during the pandemic, the government stepped up and said, hey, we need to use more technology to get patients home sooner and out of hospital. So they started giving funding to hospitals to buy products like ours, and that really shortened the sales cycle. Here, there may not be as much government direct funding to institutions to just suddenly procure technology.
Got it. Well, you've seen when you walk around the booth, AI is basically on every stand.
Never heard of it. What's the AI thing?
Well, for me as an old person, Allen Iverson is.
I love that. Oh my God, he was my favorite basketball player.
Oh,
yeah, when I was a kid. Yeah.
So yeah, AI is for me is Allen Iverson, not artificial intelligence. But are you already incorporating AI into your solution?
Yeah. So what's interesting is that we work with directly health systems to deliver their healthcare protocols and education to the patient. And so where we are providing conversational AI is actually using retrieval-augmented generation, or RAG. Mm-hmm. So that way, if the patient asks, Seamless, hey, how should I recover after surgery? It's only giving patients responses that actually are vetted by the care team's own content knowledge base. So for example, like if you were to go to ChatGPT as a patient and say, hey, I've had my surgery, when should I take my bandages off? ChatGPT would say, well, the typical surgery, take it off after, 2 days. But your healthcare team might actually have a specific bandage that they gave you where you should take it off after a week. Our conversational AI would actually tell you, for you, take it off after a week. And so it gives the right context to the patient.
Got it. Is agentic AI the next step?
It's something that we're looking at. We haven't done it quite yet. I think right now, the limitations actually aren't the technology. It's what's the right use case, the right workflow. If you can figure that out, you can build the tech. But I think we've all made that mistake in healthcare where we build the tech first and then try to stuff it into the workflow. And now we don't do that, right? So honestly, our speed with AI is based on the speed that health systems are willing to adopt it.
All right. I've been following you for a while on LinkedIn. And you seriously, I don't know, you crack the algorithm and your posts are going viral all the time. How do you do that? Tell us the secret.
Well, step one, if you post a lot, eventually somebody will take off, right?
Okay.
But I've learned a lot from others. So, some things that work for me, I think one is write about things that you genuinely are curious about because it makes it easier. So I typically write about stuff that I find interesting and that I've been thinking about. I think two is, you've probably heard this too, but the hook or the first sentence matters a lot. So there are times where I've spent an hour writing what I thought was a great post, and I think the first sentence wasn't that compelling, and then no one cares. But then there are times where I wrote something in 10 minutes, but I think the first sentence was really attention grabbing, and it takes off. So how much time you spend writing something doesn't actually correlate with the value people see. And so I wish I could predict which ones will take off. I'm getting a bit better at it, but I'm often wrong, so.
That's interesting.
Yeah.
Does that help you to build your personal brand as a founder? That exposure on social media?
Yeah, so one of the really neat benefits, which I didn't expect at all, was there are a lot of folks who are on LinkedIn at say health systems who they don't comment, they don't like, they don't engage, but I'll just have a meeting with them and they'll say, hey, I really like that thing that you wrote. Or, oh wow, like I realize how I know you. You're that guy who posts way too much and has like all the pictures and the cartoons. And so I think it creates some sort of like subtle trust where they go, oh, like you're familiar to me. And we're humans, like we appreciate familiarity. So like, for example, you, like I recognize like you from your podcast with Sergey, right? I'm like, oh, like I know we haven't met, but like I feel like I kind of know you and that makes me more comfortable, right?
I love it. But for healthcare executives, please like our posts. It's okay.
Yeah, you're free to. It's highly encouraged, yeah.
Yeah. All right, we're at ViVE. Any second day, any insights you already are taking away from this conference?
I'll be honest, I don't notice that much of a difference from last year, right? You would think that with the rise of like agentic AI and all the advancements, there'd be a lot of new stuff, but I've kind of heard a lot of the same stuff. I would say one big difference is, I think last year there was a lot more like AI scribe stuff. I think now folks have moved on to like next use cases. So I think that's better, there's more diversity in what we're seeing, but I haven't seen any like massive breakthroughs that people are talking about. So maybe that'll come next year.
Maybe. No, it's a good point. But do you think we kind of figured out the AI scribe part already? Because we had this event, actually Sergey was moderating back in New York in December, with a bunch of clinicians and nurses. And they're like, you know what? We don't really like the quality of AI scribe tools we use. And I'm like, I also thought I thought we already like figured that part out, but not sure that's the feedback from the clinicians. What do you think?
Well, I mean, it's a mixture of like how good the tech is and how good the implementation is. So even, I mean, you know, even the same technology, if implemented poorly, may not work out well. What I am hearing though is that I think a lot of folks feel as if the outpatient AI scribe at the doctor's office has been figured out. But when you talk to folks about the in-hospital, inpatient side, that's definitely not figured out. I mean, you imagine going to a patient's room and you're taking care of a patient, you're not verbalizing every little thing you're doing. So what I'm hearing more of here is, hey, computer vision, ambient in the walls, watching the encounters, and then turning what the AI sees into documentation. Oh, you know, the nurse did this or the physician did that. That's probably more what ambient's gonna be inside the actual hospital room.
Last question from me. What's number one thing you're most optimistic about for 2026?
Wow. I'm biased, but I am seeing more of a rise of, hey, like we spent the last few years really worrying about how do we improve, you know, physician and nursing and clinician wellness, and patient experience took a bit of a backseat, I feel. I'm seeing that come back to the front. I think LLMs being used by consumers for healthcare kind of forces patient experience and consumerism to the forefront again, and I'm in that space, so I'm seeing it come back up and I'm excited for it.
Best of luck, Josh.